Hello there. I am so glad you could join me today. We are going to sit down and have a very important conversation, one that I know is on the minds of many of us as we move into this beautiful stage of life. You see, taking care of our health is one of our top priorities. We want to stay active, we want to be there for our families, and we want to enjoy these years to the fullest. But often, there is a shadow that follows our health care, and that shadow is the cost. Medical bills can be overwhelming. They arrive in the mail, full of codes and numbers that don't seem to make much sense. It can feel like you are facing a mountain that is just too high to climb. But I want you to take a deep breath and know that you are not alone in this. Millions of Americans over the age of 55 deal with this every single day. Today, we are going to talk about how to navigate these bills, how to lower them, and how to find peace of mind. We are going to take it slow, step by step, so that by the end of our time together, you feel empowered and in control. In the next 40 minutes or so, we are going to dive deep into the world of medical billing. Now, you might wonder why we need to spend so much time on this. The truth is, the medical billing system in our country is incredibly complex. It isn't designed to be easy to understand. For those of us over 55, this is especially important because our healthcare needs tend to change. We might be visiting the doctor more often, or perhaps we are managing a long-term condition. This means more paperwork and more bills. We are going to look at the most common mistakes people make when they receive a medical bill. Many people simply see a total amount and write a check because they trust the system. But the system is run by humans, and humans make mistakes. We'll talk about why you should never pay the first bill you receive and what you should do instead. It is about being your own advocate, or an advocate for your spouse. I will also explain the specific terms you see on your statements. Terms like deductible, co-insurance, and out-of-pocket maximum. Understanding these is like having a map. Once you know the language, the mountain doesn't seem so high. We will also talk about how to communicate with hospital billing departments in a way that gets results without causing you unnecessary stress. This video is designed to be watched slowly. If you need to grab a cup of tea or a notepad, please feel free to do so. We aren't in a hurry. My goal is to make sure that by the time we finish, you have a clear plan. You deserve to spend your retirement focusing on your hobbies and your loved ones, not worrying about a stack of papers on the kitchen table. Stay with me because the information we are about to cover could save you thousands of dollars. Let's start at the beginning. To lower your medical bills, you first have to understand what you are looking at. When you go to a doctor or a hospital, you don't just pay for the visit. You are part of a complex transaction between the provider, your insurance company, and yourself. The first thing you will often see is not actually a bill, but something called an explanation of benefits, or an EOB. An EOB is a document from your insurance company. It is very important to remember, this is not a bill. I will repeat that because it is a common point of confusion. The EOB is just a report showing what the doctor charged, what the insurance covered, and what you might owe. Many people see the total owed on an EOB and panic, or they try to pay it immediately. Wait until you get the actual bill from the doctor's office or hospital. Now let's talk about the itemized bill. When you get a bill in the mail, it usually shows a single large number for services rendered. This is a summary. You have the right, and you should always exercise this right, to ask for an itemized bill. This is a detailed list that shows every single aspirin, every bandage, and every specific test performed. Why is this important? Because when things are listed out, mistakes become much easier to spot. Think of it like a grocery receipt. If the cashier told you the total was $200, but you only bought a few items, you would want to see the receipt to see if you were charged for someone else's steak or a gallon of milk you didn't buy. Medical bills are the same way. Sometimes a code is entered incorrectly, or a procedure you never received is added to your file. When you ask for that itemized list, the billing department often does a self-audit, and sometimes the price drops before you even say a word. We also need to talk about in-network versus out-of-network. For those of us on Medicare or private insurance, staying in-network is the most effective way to keep costs down. An in-network provider has a contract with your insurance to charge lower rates. If you go out of network, even by accident, the cost can double or triple. Always ask, is every person who will be treating me today in network for my specific plan? This includes the doctors, the lab technicians, and the specialists. Finally, let's mention the deductible. This is the amount you pay out of your own pocket before your insurance starts to help. If you have a $2,000 deductible, you pay the first $2,000. Once that is met, your insurance kicks in. Understanding where you are in your deductible cycle for the year can help you decide when to schedule certain procedures. If you've already met your deductible in October, it might be cheaper to have that elective procedure done in November rather than waiting until January when the deductible resets. Common mistakes. Now that we have covered the basics, let's talk about the mistakes that many of us make. These are not things to feel bad about. The system is designed to be confusing, but once you know what to look for, you can avoid these traps. One of the most common errors is something called upcoding. This happens when a provider uses a code for a more expensive procedure than the one you actually received. For example, you might go in for a simple office visit that lasts 15 minutes, but the bill shows a code for a complex consultation. The difference in price can be hundreds of dollars. This is why having that itemized bill we talked about is so vital. If you see a term on your bill that sounds more complicated than what actually happened during your visit, don't be afraid to call and ask for a clarification. Another frequent mistake is balance billing. This is a bit technical, but please listen closely. Balance billing occurs when a provider bills you for the difference between what they charged and what your insurance company agreed to pay. In many cases, especially with Medicare and many in-network contracts, this is actually illegal or against the terms of the contract. If your insurance says you owe $20, but the doctor sends a bill for $50 to cover their extra costs, you need to speak up. Many people also forget to check for duplicate billing. It sounds simple, but in a busy hospital, it is very easy for a nurse to enter a medication twice, or for a lab test to be billed twice, because two different departments handled the paperwork. When you look at your itemized list, look for repeating dates and identical prices. If you see the same charge twice on the same day, there is a very good chance it is an error. A major mistake is simply ignoring the bill because it is too high. I know it can be scary to look at a bill for $10,000 when you are on a fixed income. It makes you want to put it in a drawer and forget about it. But ignoring it is the worst thing you can do. It can lead to the bill being sent to a collection agency, which adds more fees and stress. Instead of ignoring it, call the billing office. Most hospitals have a financial assistance department. Lastly, many people don't realize that they can negotiate. We often think of medical bills like a tax, something that is set in stone. But in reality, medical prices are often negotiable, especially if you are paying out of pocket or have a high deductible. Asking, is there a discount for paying the full amount today? Or, can we settle this for the Medicare equivalent rate? Can lead to significant savings. It never hurts to ask, and the person on the other end of the phone is often authorized to give you a discount if you just ask politely. Real-life situations. Let's talk about how this looks in the real world. Imagine you had to go to the emergency room. It was a stressful night, and a few weeks later, the bills start arriving. You get a bill from the hospital, a bill from the doctor who saw you, a bill from the radiologist who looked at your x-ray, and maybe even a bill for the ambulance. This is what we call fragmented billing. It is very confusing because you feel like you are being billed 4 times for the same visit. In this situation, the first step is to stay calm and organize the papers. Create a folder for that specific date. Match the bills to your explanation of benefits from your insurance. Sometimes the doctor's office sends the bill before the insurance has even finished processing it. If you pay it right away, you might be overpaying. Wait until the insurance company says, "This is your responsibility." Think about another common scenario. The pharmacy. Many of us take regular medications. Have you ever noticed that the price of your prescription changes from month to month? This can happen because of changes in your insurance formulary, which is just a fancy word for the list of drugs they cover. If your medication suddenly becomes very expensive, talk to your doctor. Often, there is a generic version or a different drug in the same class that is much cheaper, but works just as well. Also consider the cash price. This is a secret that many people don't know. Sometimes the price of a drug or a procedure is actually lower if you pay cash than if you use your insurance. This sounds strange, I know, but insurance companies have complex agreements, And sometimes your copay is actually higher than the pharmacy's retail price for a generic drug. Always ask the pharmacist, what is the lowest possible price for this if I don't use my insurance? We also see situations where a procedure is denied by insurance. Maybe your doctor said you needed a specific scan, but the insurance company says it wasn't medically necessary. This is not the end of the road. You have the right to appeal. An appeal is simply asking the insurance company to look at the case again. Often, a letter from your doctor explaining why the scan was needed is all it takes to get the bill covered. Don't take no for an answer on the first try. In all these real-life moments, the key is patience. The billing cycle moves slowly. It can take months for everything to settle. During that time, keep a log of who you talked to, what day you called, and what they told you. This log is your best friend if there is a dispute later on. It shows that you are organized, that you are paying attention, and that you are committed to resolving the bill fairly. Practical steps. Now let's get into the specific practical steps you can take today. If you have a bill sitting on your counter right now, here's what I want you to do. Step 1. Request that itemized statement. Call the number on the bill and say, I would like a detailed itemized statement with CPT codes. CPT codes are the 5-digit numbers that identify exactly what service was provided. This is the receipt we talked about earlier. Step 2. Compare that itemized statement to your medical records. Did you actually stay in the hospital for 3 days, or was it 2? Did you receive the physical therapy session listed on Tuesday? If you see something that doesn't match your memory, highlight it. These are your points of negotiation. You should not pay for services you did not receive. Step 3. Check for unbundling. This is another common error. Sometimes a hospital will bill for a set of services, like a surgery, and then also bill you separately for things that should have been included in that set, like the sutures or the recovery room time. It's like a restaurant charging you for a burger and then charging you extra for the bun and the patty. Everything that is part of a single procedure should be bundled under one code. Step 4. Search for the fair market price. There are websites like Healthcare Blue Book or Fair Health Consumer. You can type in your zip code and the CPT code from your bill, and it will tell you what the average price for that service is in your area. If the hospital is charging you $5,000 for a procedure that usually costs $2,000, you have a very strong argument to ask for a reduction. You can say, I see that the fair market price in our city is much lower. Can we adjust this bill to reflect that? Step 5. Contact the Financial Assistance Office. Almost every nonprofit hospital in the United States is required by law to have a financial assistance policy. This is often called charity care. Depending on your income and your household size, you might qualify to have your bill reduced by 50%, 80%, or even wiped away entirely. You don't have to be destitute to qualify. Many middle-class retirees qualify for some level of assistance. Step 6. Set up a payment plan. If you have verified the bill is correct and you've asked for discounts, but the total is still more than you can pay at once, ask for a no-interest payment plan. Most medical providers would rather receive $20 a month for a long time than receive nothing at all. Never put a medical bill on a high-interest credit card. That just turns a medical problem into a high-interest debt problem. Always negotiate the payment plan directly with the provider. If the situation is difficult, I want to take a moment to speak to those of you who might be feeling very stressed right now. Perhaps the bills are very large, or perhaps you are dealing with a serious health challenge while trying to manage this paperwork. I want you to know that it is okay to feel overwhelmed, but I also want you to know that there is a path forward. There are people whose entire job is to help you with this. They are called medical billing advocates. If your bill is very large, say over $5,000, it might be worth hiring a professional advocate. They know all the codes, they know all the laws, and they know how to talk to the insurance companies. Often, they work for a percentage of the money they save you. This means if they don't save you money, you don't owe them anything. They can take the burden off your shoulders and let you focus on your health. Also, remember that you have rights under the No Surprises Act. This is a relatively new law that protects you from unexpected bills when you receive emergency care or when you are treated by an out-of-network provider at an in-network facility. If you feel like you've been surprised by a bill you couldn't have avoided, mention the No Surprises Act to the billing office. It is a powerful tool for patients. I want you to be gentle with yourself. You have spent your life working hard and contributing. You deserve to be treated with respect by the healthcare system. If a billing representative is being rude or unhelpful, you can always ask to speak to a supervisor. You can always hang up and call back to speak to someone else. You are the customer, and you have the right to clear, honest answers about what you are being charged. It is also important to talk to your family. Sometimes we try to hide these stresses from our children or our siblings because we don't want to worry them, but often they want to help. They might be better with computers or more comfortable making these phone calls. Letting someone help you with the paperwork isn't a sign of weakness. It's a sign of wisdom. We are all in this together, and sharing the load makes it much lighter. Take things one day at a time. You don't have to solve the whole mountain today. Just make one phone call. Or ask for one itemized bill. Those small steps add up. Before you know it, that mountain will start to look like a small hill. You have the strength and the intelligence to handle this. You have navigated many challenges in your life, and this is just one more that you will get through. To help you with these steps, I have put together something special for you. It is a simple, professional PDF checklist that summarizes everything we have talked about today. It includes the questions you should ask when you call the hospital, the terms you should look for on your bill, and a step-by-step guide on how to request your itemized statement. It is designed specifically for my friends who are over 55 and navigating this system. This checklist is completely free. I wanted to create something you could print out and keep in your medical folder, so you don't have to remember everything from this video. It is a professional resource meant to give you confidence when you are sitting at that kitchen table looking at your bills. You can find the link to download it right in the description box below this video. Just click the link and you can save it to your computer or print it out. There is no catch and no pressure. I just want you to have the tools you need to protect your savings and your peace of mind. Having a physical list in front of you can make the process feel much less intimidating. It's like having a friend there with you, reminding you what to do next. I hope you find it helpful as you take these steps to lower your medical costs. Frequently asked questions before we wrap up. Let's answer a few questions that I hear very often. The first one is, will my doctor be upset if I negotiate the bill? The answer is almost always no. The doctor rarely even knows what happens in the billing department. Their job is to care for you. The billing department's job is to manage the money. Negotiating a bill is a standard business practice and won't affect the quality of your care. Another question is, what if I already paid the bill, but now I think there was a mistake? You can still take action. It is harder once the money has changed hands, but you can still request an itemized bill and audit it. If you find a clear error, the provider is generally required to issue a refund. It may take some persistence, but it is your money, and you have the right to get it back if you were overcharged. People often ask, does Medicare cover everything? While Medicare is a wonderful program, it does have gaps. This is why many people have Medigap or Medicare Advantage plans. Each plan has different rules. If you are confused about what your specific Medicare plan covers, you can call 1-800-MEDICARE or talk to a local SHIP counselor. SHIP stands for State Health Insurance Assistance Program, and they provide free, unbiased help for seniors. Finally, how long should I keep my medical bills? Generally, it is a good idea to keep them for at least 3 years. This is because insurance audits or billing disputes can sometimes pop up long after the service was provided. Having your records organized by year makes it easy to find what you need if a question arises later. Once you are sure everything is settled and the time has passed, you can shred them to protect your privacy. We have covered a lot of ground today. I hope that you feel a little lighter now than you did 40 minutes ago. Remember, the most important thing is to take that first step. Whether it is asking for an itemized bill, checking a CPT code, or just organizing your papers into a folder, every action you take is a win. You are taking charge of your financial health, and that is a very brave and wise thing to do. Please remember that this video is for educational purposes only. I am here to share information and help you understand the system, but always check with a professional if you need personal, financial, or legal advice. Every situation is unique, and you deserve advice that is tailored to your specific needs. Don't be afraid to reach out to experts who can guide you through your individual journey. As we finish our time together, I want to encourage you to stay positive. The world of medical billing is complicated, but it is not impossible to navigate. You have the tools, you have the resources, and you have the right to be treated fairly. Take a moment today to do something you enjoy. Read a book, take a walk, or call a friend. You've done the hard work of learning something new today, and you should be proud of yourself. Thank you for spending this time with me. It has been a pleasure to go on this journey with you. I look forward to seeing you again soon. Until then, take care of yourself, stay curious, and remember that you are never alone. Have a wonderful and peaceful day.